Each year, a little over 1 million Belgians consult an osteopath, with back pain being the main reason for consultation. Each consultation starts with a thorough medical history, during which the osteopath listens to the patient and asks targeted questions in order to establish a working diagnosis and to check for yellow or red flags. Through classical orthopedic tests as well as active spinal movement tests in standing, sitting and lying positions, the osteopath establishes a first assessment of mobility and any visible or palpable limitations. To exclude any medical pathologies, other tests, such as percussion testing, may be performed. In case of peripheral neurological symptoms, specific tests are necessary, including power tests, reflexes and sensitivity tests. Since an osteopath always views and treats a person as a whole, he will conduct a complete assessment of their mobility literally from head to toe. The anterior structures, such as the abdomen and diaphragm, need also to be evaluated. Through precise palpation of the position of the vertebrae, correlated with the movement examination, the osteopath forms a picture of where a correction, if necessary, should be made. Based on clinical results, a working hypothesis is developed and presented to the patient. The osteopath has a wide range of manual hands-on techniques at their disposal, ranging from joint mobilizations or manipulation to muscle soft tissue or inhibition techniques. In addition to musculoskeletal corrections, an osteopath may want to address tissue tension in the abdomen and diaphragm. Since the entire vertebral column is considered as a functional whole, any limitations within the thoracic and cervical region will also be addressed if they are deemed relevant in the context of the patient's symptoms. Finally, the osteopath will usually recommend to the patient specific exercises, as well as encouragement to keep moving. After the treatment, the patient will receive a payment receipt, which can be used for a partial refund by the Belgian Complementary Health Insurance. In addition to musculoskeletal disorders, a significant number of patients also consult an osteopath for other pain issues. Headache, and more specifically cervicogenic headache, is a common reason for consultation. A few standard tests are performed to check the patient's condition. The osteopath checks the mobility of the various musculoskeletal elements and notes any limitations. With each complaint and treatment, the osteopath conducts a complete assessment, bringing together all the elements related to the complaint, and a treatment plan is formulated and carried out based on that. Given that the body functions as a whole, it is important to examine other structures first and normalize them if necessary, after which it will be possible to correct the limitations and movement in the specific musculoskeletal segments related to the reason for consultation. Particular attention will be paid to the temporomandibular complex. There are manual techniques to correct this. The osteopath will then give the patient advice and exercises to be applied in everyday life to help avoid recurrence. More and more parents are consulting an osteopath with their baby for functional disorders such as premature birth, reflux, excessive crying, and persistent preferential postures. It is then essential that the osteopath gets to know about the course of the pregnancy, delivery, and development. As babies are not mini adults, they require a specific examination and approach. Mobility of the neck and the relationship between the pelvis, abdomen, neck and skull are among the things checked. A number of techniques aim to normalize the tension and asymmetry of the tissues in order to improve function. Several recent publications show that the stay in the premature unit is significantly shorter for moderately premature babies when treated by an osteopath. Osteopathy is a socially accepted part of healthcare. This manual medicine is safe, efficient and cost-effective. The approach is primarily focused on MSK disorders, but can also be used for somatic unexplained physical complaints outside the MSK system.